Okay, well, everyone, welcome to the Ask Your Gynae session for the 2020 Power Woman Conference Day 1. We have already logged on our guest doctor, Dr. Audrey Gugu Gamete. We have another doctor who's going to join us. We're just waiting for her to log in. But I want to just say welcome, welcome, welcome. We have taken some of the questions that you sent in and we forwarded them to the doctors, and they're going to be answering them just now. So we just want to give 1 or 2 minutes before I formally welcome Dr. Gamete, just for people to settle in, and then I'm going to welcome Dr. Gamete, and then we're going to run.
Do you have the questions?
Okay, we're just confirming that everyone is good. All right. Okay. All right. Okay, we are ready to go. Dr. Gamete, are you good? Are you ready? All right, everyone. I want to welcome our guest doctor today, Dr. Audrey Gugu Gamete. All right. Sorry for that technical hitch. All right. Dr. Audrey Gugu Gamete is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman and is still passionate about wanting to learn more about women. She has been a Christian since she was age 13. Wow. Wow, that's born again from the womb. And has never looked back since then. And she is a mother of 2 children and been married for almost 2 decades, or more than 2 decades. Dr. Gamete, we are grateful for affording us your time to answer the questions and minister to the ladies tonight. Welcome.
Thank you very much, Pastor Chooks. May I humbly acknowledge with gratitude the opportunity granted to me, to you, Pastors Toyin and Pastor Chooks, and also to say thank you to the honorable speakers that I've listened to beforehand, Pastor Chooks and Dr. Kupe. Wow. And then also to the colleagues who are logged on from the various countries or the globe. Thank you very much, colleagues. And lastly, to the super abundant women who have logged on worldwide. Welcome to the Gynae session, to the Ask Your Gynae question. I am so much humbled with gratitude, though, to be part of this wonderful team and to minister to women. What Dr. Cooper shared in this evening was very fundamental, to say that we need to bring the vessels. I am also queuing, helping those vessels. We cannot be super abundant women if we are not physically well. So I am just here to say, bring the questions. I am sitting in the consulting room because I'm on call but bring the questions out of the consulting room so that we can be able to assist each other. Thank you very much. I already have 30 plus questions in front of me. I've tried to group them according to the groups in which they belong. I will still be taking more of our questions. If I'm moving very fast, please give me a hint that I'm moving very fast, and I'll try to answer as many questions as possible. There's questions 1 to 4. They're very interesting. How should I choose a gynae, and what factors should I consider? Question number 2, I'm too anxious and embarrassed to see a gynae. What can I do? Number 3, how often should I see a gynae? Number 4, at what age should my daughter see a gynae? So to answer that question, I would like to say that a gynae is basically a doorkeeper to a woman's life. Both obstetricians and gynecologists are referred to as gynaes. An obstetrician takes specific care to a pregnant woman. A gynecologist takes specific care for any woman. So if you choose that kind of a doctor, it should be somebody that you relate to. It should be somebody that you trust. It should be somebody that you'll be open to. It can be a male, it can be a female. Both genders work diligently to ensure that the woman is taken well care of. The factors that also you should consider are proximity to where you are. Should an emergency arise, you need to have your doctor accessible to you. The other factor that you should consider is relations. If a doctor or a gynae is your relative, it is ethically discouraged that that doctor becomes your managing gynecologist. You can use that gynecologist for consultation, but for management, to prevent biasness, it is always advisable to get somebody who is outside your family circle. Being embarrassed and being anxious when you go to a gynae, it's a common phenomena, mostly because we are raised up knowing that the structures of a woman or the intimate part of a woman is associated with a taboo, of which that is what we are trying to destigmatize. So most of the younger crops are very comfortable with going to a gynecologist. So if you feel anxious and embarrassed, try to choose somebody whom you identify with, either age-wise. Other people feel more comfortable with younger gynecologists if they are young. Others feel more comfortable with older gynecologists because they want that maternal impact. So those are the factors you can consider when you choose a gynecologist. As to how often you visit a gynecologist, really it depends on your need. But it is stipulated that at least once a year, a woman must have a gynecologist check-up. Then if you are in your reproductive age, say you are expecting or you are pregnant, once a month will be the time when you see your gynecologist. If you've got a chronic disease that is being managed, that will depend on how often your doctor wants to see you. Welcome, Dr. Maka. I'm very excited to see one of my colleagues. Question number 5 is around menstruation. Menstruation is what defines us as women. We do expect that if you are very fast, by the age of 12, you start your menstruation. If you are very slow, at least by the age of 15, you have started your menstruation. So question number 5 says, I get my period only 2 or 3 times a year. Is this normal? A big no, it is not normal. Question number 6, I get terrible cramps with my periods. What is wrong? There is something that is wrong. Question number 7, is bleeding between my periods normal? It is not normal. Okay, when we attack the question around menstruation. So menstruation is a phenomena that happens if you have a regular cycle. It will be anything between 26 days to around 30 days. So by cycle, we mean from the first day of your period to the first day of the next period. That equates to a cycle. So if you are having your periods 2 or 3 times a year, you have a condition which we call oligomenorrhea. That means that you have very few periods in a year, and that is usually associated with a hormonal imbalance, which can result in a metabolic disease. The commonest cause of such illness is usually polycystic ovaries. When we talk about polycystic ovaries, usually the egg basket of the woman has got lots of eggs which have not been released. So this is how the woman would look like, and this will be her egg basket. If those egg baskets do not release an egg every month, they are going to be full. When you look at them with an ultrasound, they look like a bunch of grapes. So that will result in hormonal retention. I can expand on that and make it a topic on its own, but it is usually polycystic ovarian syndrome, and those women are usually having difficulty controlling weight. They are much more prone to diabetes. As they grow, they can even have issues with falling pregnant because the cycle is not normal. Also, you can also have metabolic diseases that will include diabetes, hypercholesterolemia. So it is an abnormal condition that needs to be investigated and it needs to be treated. In the long run, these are the ladies who will start developing hair in a distribution of a male pattern because the testosterone levels are very high. Can I stop there in this?
Hold on. I want to welcome Professor Amaka Ocheke. Amaka, you're welcome.
Can you hear us?
Can you hear us?
Yes, I can hear you.
Oh, great.
Great. Well, we are so delighted to have you. You are online. The whole world is watching. Thank you. Thank you for joining us. Can I say, ladies and any gentleman who is joining us for the session, please, wherever you are logging in from, welcome our dear friend, Professor Amaka Ocheke, joining us tonight. Let me tell you a little bit about her so that we all know who she is, and then we can carry on with the questions. Professor Amaka Ocheke is a consultant obstetrician and gynecological surgeon. She obtained her MBBS degree in 1995 from the University of Port Harcourt with a deep passion to make women's life better. She proceeded to obtain her fellowship after her postgraduate clinical training in Nigeria in 2006, becoming a specialist in the field of obstetrics and gynecology. She is a member of CMDA, Society of Gynecology and Obstetrics of Nigeria, SOGON, West African College of Surgeons. She is currently serving as the head of Department of Obstetrics and Gynecology at the University of Jos. She is married and has 4 children. Well, that's the official one. The unofficial one is that Amaka has been my friend from when we were at university. Yeah. Amaka, you are welcome. Well, I should be calling you Prof. I should get used to calling you Prof.
Prof.
No, Amaka is fine. Amaka is fine. I like the name and I like the meaning. So it's nicer than Prof.
Well, welcome. Thank you for joining us tonight. We're already taking a few questions. So Dr. Gamedze will go to the next set of questions. Please meet Dr. Gamedze. Let me make the introduction on screen. Dr. Gamedze meet Amaka, and Amaka meet Dr. Gamedze.
Good to meet you. Hi.
All right, Dr. Gamedze, you can carry on with the next set of questions, and then Amaka can come in where she feels she can come in.
Good to meet you, Prof. Thank you so much.
Thank you. But Amaka is fine.
Okay, we were just discussing why it is wrong to have 2 or 3 periods per year. So the conclusion there is please do make time to see your gynecologist so that this can be sorted. Period pains. Period pains are a very common occurrence with all women. Oftentimes, it is because there is nothing wrong, and sometimes as we grow older, if they persist, it is because there is something wrong. Commonly, what we see is what we call endometriosis. That is a common occurrence from very young girls. We are seeing it from teenage stage up until premenopause. And also with ovulation, there are cramps associated. So I normally say that a woman must time or must track her period. If you are tracking your period, it's easier to know that I am around the time of ovulation, then yes, I am expecting period pains. Or now I am starting my periods, I am getting period pains. When do you get them? Do you get them at the beginning of your periods? Do you get them at the end? Do you get them mid-cycle? Do you get the period pains throughout? And how is the intensity as you progress with your periods? So period cramps can be treated if they are caused by just the prostaglandin, which are the chemical factors that we think are mostly responsible for period pain. Usually those women, they respond to Panadol, they respond to Nurofen, which is ibuprofen, and also we can modify their clotting. Sometimes if you clot a lot, that can also give you a lot of pain as the clots come out. I've heard some ladies saying that during their period, they actually pass out. That will be due to a lot of the clots coming out and getting stuck on the cervix. Wow. So that we can modify with medication. So if you are not coping with period pains, please do seek help. There is an age band after 20, between 20 and 40, you find that in that age group, period pains can be due to fibroids. They can be due to a condition that is called adenomyosis. It is down my list. Hopefully we will get to talk about that as to what it is. So with those, you need to be checked by your doctor. GPs are very good even in diagnosing those. And then management-wise, the intervention can be at GP level and it can be at specialist level. So please do check why you are getting terrible cramps. That's the magic word, the terrible cramps. I don't know, Prof, whether there is anything you'd like to add there around periods.
I think you've basically covered most things, what people should know about periods. And just to reiterate the fact that if people have unbearable period pains, then they should see a doctor and not continue to manage it, because other things could be causing the period pain. So they need to be sure you rule out all those other things. So if it's bad, then you need to see a doctor, as you have already told us earlier.
Okay, and then the last question around the bleeding. Is bleeding between my periods normal? It is not supposed to happen, but it depends on what is called bleeding. So some people will have something that equates to a menstrual flow, where they'll have to use pads. That is abnormal. Other people will experience what is called spotting. That sometimes can happen if there is an irritation. Can you hear me?
Yes, we can.
Yes,
Connection still good?
yes.
Okay, thank you. There is what is called cervical irritation. So a girl, this is my girl, this would be the vagina, and up there is the cervix. That is what we normally sample when we do a pap smear. If you've got an infection that irritates the integrity of the cervix, you can get spotting in between your periods. That can be associated with intimacy. It can also happen also when you just go to the toilet and you wipe. you see some streaks of blood. I must highlight though that some people do have bladder infection, and when you go to the toilet, you wipe, because the pain is just lower down there, you wouldn't know where is this bleeding coming from. So then you need to assess which of those three openings lined up as they would be. Is it because you have a bladder infection? Is it because there is an issue in your womb, in the vagina, or on your cervix? Or it's because you've got hemorrhoids, or you were badly constipated and you tore at the back when you made number 2. So that can cause bleeding. If the bleeding is between periods, that is abnormal. It means that your hormones are acting up. You need to seek for medical attention. That is about periods. How much should a woman bleed during a period? Prof, would you like to take that one?
Okay, fine. But just to add concerning the bleeding in between periods, once in a while also there are people who, when they ovulate, they spot. Some people at ovulation, they spot, and it's just a spot. And as you said, that is spotting, is not bleeding, to be able to differentiate between spotting and bleeding. So some people during ovulation, they spot. And then there are also some people who, they are thinking they're in between menses, but they're already pregnant. So as implantation is going on, they could also have some bleeding. And that's implantation is as the fertilized egg is trying to find its accommodation, as in quotes, in the uterus. Then you could have some slight bleeding, but it shouldn't be anything heavy or anything that looks like heavy normal menstruation, really. Then the question you asked, sorry, I lost my train of thought. What was the question again? Sorry.
The question was, is bleeding between my periods normal?
Okay, no.
So then I said that maybe you can allude as to how much should a woman bleed during a period.
Okay. Theoretically, what is in the books is that during a period you shouldn't lose more than 80 mils of blood, and that's pretty small. It's not a lot. But of course, nobody goes around with measuring jars and cups to measure how much blood they are losing. So just to, as a guide, when you are menstruating, you shouldn't have to change pads so often. For women who are very hygiene conscious and all that, changing pads 2 to 3 times a day is fine. And as you change the pads shouldn't flood. That means they should be so full of blood throughout. Then that's fine. And then ideally you shouldn't have blood clots, thick blood clots, because that is also an indication that you're bleeding heavily. And then on the average, many people will bleed from 2 days to like 5 days. When you start doing more than a week, 2 weeks, then that's also a problem. You shouldn't bleed for too long. So I think that's a general guide. Google, I don't know whether you have something, maybe you could add more to that.
I appreciate that. So nowadays, because we also don't know the cups and so on, there is a menstrual cup available actually that most women have started using. It is a substitution for the pads silicone cup. So you can empty that cup once a day. If you empty your cup once a day, that is a normal bleeding. Then also the size of the pads that you are using. Pads are normal. There's Maxi, there's Night Maxi. Once you start using Maxi, there is something that is not right when it pertains to your flow. Or if you use Maxi, it should be on your first day, not throughout your periods. Okay, and then there's one question about contraception. How do I know which method of contraception is best for me? When it comes to contraception, I like to say that contraception is not one size fits all. And it is not according to generations that my mother used this, I will also use it. It also qualifies your needs as a woman. There is a woman who says, I am starting my medicine degree. I want to finish it before I have a baby. So you look onto a long-term contraception. There is a woman who says, my partner is overseas. I see him once a year or once in 6 months. Then that person does not need to be on continuous contraception. There is somebody who says, I'm nursing a baby. I do not want to fall pregnant anytime soon between now until my baby is 2 years old. That person needs short-term contraception, but one that is going to be safe for a nursing mother. That is when it comes to breastfeeding. There is a woman who says, I have a history of deep vein thrombosis, I have kidney failure, I have liver toxicity, I have a lot of diseases that run in my family. So that woman needs a special selection of contraceptives that is not going to predispose to clotting. And then there is a woman who says, I am so fat. I don't want to gain more weight on this. I have so much acne. I don't want acne on contraception. So we always factor a comprehensive history when we want to start on contraceptives. So it's based on your history, it's based on your wishes, and it's based on your health profile. But usually, for starters, I'm gonna make scenarios just so that we get to understand how you choose a contraceptive. So contraceptives have different forms. There is tablets, which is a daily dosing. You wake up, you consciously decide, I'm gonna swallow this pill. So that needs people who are very structured, who are not forgetful. And then we've got the injections. The injections usually carry one strain of a hormone. So that you get the injection once in 3 months or once in 2 months. It works very well for long distance travelers who don't want to carry the baggage of tablets. And then we also have what we call the ring. The NuvaRing you insert in the vagina and it stays just below the cervix. That will take you 21 days and then you remove it to get your period. We also have the patch. You stick it on your skin and that stays for 7 days. You change it every 7 days. We have the loops, which are the intrauterine devices. They sit inside the womb. That can be any time from 5 years to 10 years, depending upon your needs. So that will be in a nutshell. So usually if you have a little girl who is suffering from anxiety of not falling pregnant and is also having skin issues, the combined pill is usually the first line when it comes to contraceptives. And then depending upon the needs, whether you want clearer skin, whether you do not want to gain weight, then we choose the combination of hormones that's going to suit your need. And also the size of your body. We don't want to load you with a hormone, yet your body is smaller. So we choose the dosage that will suit you. But if you want contraception that will last you a longer period of time, I would say that the loops are a better option. The loops are divided into two. There is a medicated loop and there is a non-medicated loop. The non-medicated loop is the traditional old copper. That one can stay anything from 5 to 10 years. The advantage of that is that it is non-medicated, so it is less likely to come with the hormonal baggage that most women do not like. And then we have the Mirena, which is now the hormone-pregnanted loop. With that one, oftentimes it's prescribed for women who've got severe period pains, who've got a very heavy period, and also women who do not love periods. It tends to reduce the flow to disappearance. At the interest of time, can I stop there about the contraceptives? Is there anything, Prof, you want to add on the?
No, I think you've done a good job on that. But just to say that those who are seeking contraceptives, you need to see a healthcare worker for proper assessment to know really what suits you, especially when you have a lot of health challenges, as she mentioned earlier. And then if you smoke and more than 35, and then your weight is large, some of those things you really need to be properly counseled and assessed to know what would work for you. So that's it.
Awesome. Okay, Dr. Gametse, how much more can we take for today?
We were almost going for halfway.
Okay.
Then I think we can do the discharges, because if we take the questions on sex, I think that is a bulky topic. We can do the abnormal discharges and then we pause. That should take us about 10 more minutes, then we're done.
Okay, so let's do that, then we can continue tomorrow.
Okay, so question number 12, 13, 14, and 15. It says, why do I itch down there? Where is down there? I don't know. Also, I have a discharge, but no itching or burning. Is that normal? 14, what is the best thing to do in order to know what satisfies me in bed? Okay, that one is it's a lost question. May I please defer that for the next time? Number 15, that's the last one. How do I cope emotionally when I discover that I have a sexually transmitted disease? So let me just start off by saying that the vagina is not a dry place. It is physiologically moist. That means that there are secretions to keep it moist. So those secretions are what we call a discharge and your menstrual cycle. At a certain point in time on your menstrual cycle, I'll make an example. When you are on your menses, that will be just blood. As your periods finish, it will transform from blood to brown, then white, or cream white, then white. When you are in mid-cycle or you are ovulation, it will be a clean, stretchy mucus. And then thereafter, it is white and more mucoid as you are approaching your menstruation. So, but that should not have a smell, and the color is usually white or off-white if it is on the panty liner for a prolonged period of time. So it is normal to have a discharge. It should not have a smell. It should not be itchy. It should not have an off-white color. If it is off-white color, it is going to be on the panty liner. The smell, if you are a person who is very sensitive with your nose, it is going to smell like white, plain yogurt because of the kind of germs that are found in the vagina. So if it is itchy, it is usually because you have an overgrowth of the yeast. Usually we have yeast balancing the bacteria in the vagina. If the yeast overgrows, then you're going to have that itchiness. That is usually because of hormonal imbalance as well. So sometimes you find that the itchy discharge is an indicator that you've taken a lot of carbohydrates, you've taken a lot of sweet food, or an early indication that you are getting diabetes. So not all thrush, we call it thrush if you've got the yeast infection, which is the itchy discharge. Oftentimes, if you have that, I do advocate that please do check with your doctor if your sugar levels are still okay. so it should not be itchy. If it is offensive, that is smelly, usually in the reproductive age, it will be because of an imbalance also in the amount of bacteria now that is colonizing the vagina. There is a condition that we call bacterial vaginosis. It is not a sexually transmitted infection. It is purely due to the imbalance in the germs that are in the vagina. That is where your vaginal hygiene comes in now. I know most girls want to buy the gyne guard because they feel like it's guarding where the gyne is supposed to be, but that is very invasive because now I know that when it's marketed, they say that it balances the pH. The pH is physiologically balanced. You do not need GyneGuard to balance your pH. It is physiologically balanced. So if you keep washing with soap, washing with the douching and so on, you are disturbing the colonies that are supposed to be staying there, and that can result in an offensive discharge. Later on in life, that discharge is very common to be offensive around menopause. Now the vagina is dry, the hormones are imbalanced, that will result in an offensive odor as well. So common infections also include those that are sexually transmitted. So condom usage is very much important if you know or you suspect that your partner is not faithful to you. How do I cope emotionally when I discover that I have a sexually transmitted disease? It is very difficult. You need to compose yourself emotionally before you can blame another person. Oftentimes, if you got the bacterial vaginosis, most infection, I don't like the infection. We need to test and find out what is it. Then once you have confirmed a sexually transmitted infection, then you can give that label. But a smelly discharge, most doctors will say it's a sexually transmitted infection and that hurts. So not all offensive discharges are sexually transmitted. That I want to capitalize on. And then if it is a sexually transmitted infection, you may need a psychologist intervention or Pastor Chooks and Pastor Toyin to intervene just for support so that you can deal with the source before you can decide to
yeah, we were born for it. We were born for it. They should bring it on.
Prof, please add on to the discharges.
No, I think you practically said everything that needs to be said. Any abnormal discharge they should seek for help. You should seek for help in the hospital to have it sorted out. But discharge that is, it's good for everybody to know that there's normal discharge and there's abnormal discharge. I think some people just confused with the fact that once they see anything, they're like, oh, this is a problem, this is something I need to do something about. If it's clear color to whitish, non-smelling, not itching, generally it should be normal, so that should be, and not smelly. But if there's any problem, any abnormal one, then you should seek for help so that you find out exactly what the problem is.
Okay. Is that all that you got there?
Yes, because she said practically everything. She's like a textbook.
All right. Well, for all the ladies who are watching and listening, if you are on Facebook or you are on YouTube and you want to send questions, please, there's a form. I know some people don't want to post questions on YouTube and Facebook because it doesn't hide your identity. It tells who asked question. So if you want to send more questions, you can register, and then you will get the form that allows you to send your question discreetly and privately, and then we can bring them to the doctor's notice tomorrow. But for tonight, I think we're going to roll the curtain right here. we have heard quite a bit of medicine. Even me, I can write the exam now.
No, you can't write the exam. Prof would give you. You.
All right. Well, thank you very much. Once again,
Yes.
do send us those questions. Please don't post them on Facebook because they remain there. Don't post them on YouTube because they remain there and they will remain with your name. But however, if you click on the link to register, it will send you a form, and then with that form you can send your questions discreetly and privately, and we'll be happy to send them to the doctors to address them tomorrow. Tomorrow the session will continue after the 2 sessions of teaching tomorrow evening. We would like to encourage you to share the information around the conference with all your friends anywhere they are on the planet. All they need to do is log in tomorrow and we continue. Tomorrow morning, 9 o'clock. Tomorrow is August 9 in South Africa. We are celebrating women. Tomorrow is Women's Day tomorrow. And yes. We are very grateful for all the women in our lives, our mothers, our sisters, our wives, our daughters. We are very grateful for every one of you. And we join the whole of 60 million people in South Africa to celebrate women tomorrow. I will be preaching a very powerful message. You don't want to miss what the Lord has put in my heart to share tomorrow. The message is titled, The Goodness of God Through the Womb and the Brain. The goodness of God through the womb and the brain. I'm not going to unpack it now. You just log in tomorrow morning and
on
you
the
will
same
hear.
channels, Facebook
Yeah,
and
it
YouTube.
will be available on YouTube. It will be available on Facebook. So if you haven't liked our page, please like the page on YouTube, on Facebook, so that you get notifications and when we go live. It's the same thing on YouTube. And then tomorrow evening, 5 p.m. the conference continues. 2 messages tomorrow. We have Pastor O.P. Ara from Abuja ministering tomorrow evening, and I will be also ministering tomorrow evening. And then after those 2 sessions, then we come to Ask Your Gynae, and we have Amaka. Are you joining us tomorrow?
Let's see how it goes.
Okay. All right. So tomorrow is going to be exciting. We have Dr. Gamedze on ground. We have Professor Ocheke on ground. And then also tomorrow, I've invited another friend of mine from Manchester, United Kingdom. He is an obstetrician and gynecologist, Dr. Fumi Odushoga. He will also be joining us tomorrow from the UK. So we have a male doctor to add color to the panel. So that I'm not the only man talking about women things. What is it? All right. So we're really looking forward to it. If you missed out on the first 2 teaching sessions, they are available online on our YouTube channel and on Facebook. You can go listen. Dr. Pelkupe really did an amazing job, and the things that I shared earlier on about the superabundant woman, you don't want to miss any of that. We'll continue building on it tomorrow, trusting God for revelation, for insight. I look forward to hanging out with you again around the Word of God tomorrow. Once again, we want to say Happy Women's Day to all the women out there. We look forward to an awesome time tomorrow. All right, from Dr. Gameze, any final words before we roll the curtain and close it?
Yes, Pastor Chooks, I just want to encourage women to join. We're still going to talk about sex issues, that is intimacy. We're going to talk about pregnancy-related issues. We're going to tackle fibroids. We're going to tackle endometriosis. It's going to be very much interesting. Please don't miss out. It's a free session to get all your medical issues attended to. Thank you.
All right. Dr. Gameze, thank you so much for brilliantly handling that session.
Thank you.
I think we lost Prof there.
Yeah.
But tomorrow, God help us, we will continue ministering to the ladies. Well, thank you very much, Wifey. What do you have to say?
Thank you so much. We are really looking forward to tomorrow. I really would like to hear some of the things we'll be talking about tomorrow at Ask Your Gynae. I think we will probably start a little bit on time tomorrow, probably at 7, just after 7. So please join us for the main sessions at 5 p.m. and then the Ask Your Gynae by 7:15. We probably will send the links for the Zoom webinar for tomorrow for the Ask Your Gynae. So please be on the lookout for an SMS or a WhatsApp message to give you more details on how you can send your questions. We will get some information across to you before the sessions tomorrow. It's been a great one today, and we are indeed very grateful for what God has already done. It continues tomorrow. Join us for our service at 9 a.m. and then the conference continues at 5 p.m.
Right, so tomorrow, the goodness of God through the womb and the brain. We will be hearing what God has to share with us on that message. Good night, everybody. God bless you. Dr. Gamese, God bless you. See you tomorrow.
Guest Pastor Opiaga, Dr. Pearl Coupe, and Dr. Audrey Gugu Gamedze. The theme is The Super Abundant Woman. Sessions will be from 5 p.m. to 7 p.m. daily, and there will be an Ask Your Gynae session on each day of the conference. Register online at bit.ly/POWC2020 or via WhatsApp on +27 64 200 1545. The Power of Woman Conference 2020. Become the abundant woman you are destined to be.